If you're trying to achieve weight loss, if you keep your eyes on the health benefits of losing weight, and I'm going to discuss those, it can help you keep track of making sure that you get on a program that's going to lead you toward permanent weight loss. There are so many crazy, fad, extreme diets out there. And I want to protect all of the people in my group, all of the people that I work with from getting lured into them, because it's such a waste of time and effort and money and health to do crazy things to try to lose weight. And frankly, most of the weight loss industry is full of extremes, of extreme calorie counting, where people are expected to starve and deprive themselves, of extreme exercise programs where you have to devote hours at the gym where you don't have the time, and it's beyond what you're physically comfortable with. So I want you to get used to picking up those lures and getting used to saying, no, I'm not going to do that. I'm going to respect myself and my body, and I'm not going to be lured into something that's going to give me temporary outcome and that will keep me in the weight loss yo-yo roller coaster. I want you all to feel that way, that you demand respect for yourself and you won't allow yourself to be lured in to those programs anymore. I always and I only talk about programs with my clients that will lead to permanent weight loss. I want to help you get this done permanently for good so you can have the health benefits. And I'm going to talk today about the trifecta of permanent weight loss. Any permanent weight loss program should support your health. Not only will you lose weight, but it will make you healthier. And that's why it's sustainable. That's why it leads to permanent results, because it supports health. It's not something crazy that makes you starved or stay at the gym for more than you can do sustainably long term. And also a weight loss program that will give you permanent results and will support your health. The third element of the trifecta, you will enjoy elevated energy. The clients that I work with, when they use the programs that I recommend, which support health, they find that within a week or two, they start feeling their energy increasing so quickly, because the health processes that improve your metabolism and your fat burning system to lose weight in a healthy way also improve the other health aspects and processes in your body. So, for example, there are people I've worked with who lose weight, and this happens often. They'll go back to the doctor, and the doctor will say, wow, what did you do to lose this weight? You got great results. And by the way, your medical tests came back. We can decrease your diabetes medication, or we can decrease your cholesterol medication, or high blood pressure medication, or sometimes people are taken off medication entirely, because when you lose weight and you lose it in a healthy way, not a crazy fad way, but a healthy way, you also get the trifecta of weight loss. You lose pounds, you get elevated health, and you get more energy. And so it's not just one thing that you should look for. Don't just look at the scale, because when people just look at the scale, they'll do crazy things to try to get even temporary results. And they'll go on starvation diets. They'll go on deprivation diets. They'll go to a boot camp exercise program that will give them temporary results. But as soon as they stop doing the 2 hours or whatever it is of exercise, the weight goes back up again. And that, my friends, is not healthy. I do not at all recommend my clients do crazy weight loss that's temporary, because that teaches the body the wrong thing about weight. It teaches the body that when you lose weight, you should regain it. I want people only to do weight loss programs so the results will be sustainable. The results will be perfect. So any weight loss program, the first thing you should look at is any weight loss program that you agree to go on, that you feel respects you, should be something that makes sense, not anything that's fad or crazy extreme, like you can only eat this small category of food or this small category of food, all or nothing. That is not sustainable. People are not going to live the rest of their lives on this limited type of food. And then what happens when you decide, I've had enough of this, when you go back to life as life is, people regain the weight. That is not healthy, and it's a waste of time, effort, and money. And I want to protect my clients, my people in my group, my community from that. You should be respected. Don't be lured into those temporary programs. First thing we want is to make sure it sounds healthy, not crazy. Second thing is we want to make sure that it gets rid of your obstacles. And most people know what their obstacles are. For some, one of the problems is sugar cravings. For some, it's stress eating. For some, it's binging. For most, it's a slow metabolism. For some people, it's hormonal problems related to post-pregnancy or to menopause. Whatever it is, you need to make sure that a program addresses the reason, the root cause you're holding the weight. And weight loss is not a one-size-fits-all program. Not everybody loses weight in the same way, as most of these programs do. They tell everybody, lose weight by eating this category of food, or lose weight by following this diet, or lose weight by doing this boot camp exercise program. And again, not everybody loses weight in the same way, because people have different obstacles causing them to hold weight. Some people have thyroid issues, some people don't. Some people have hormonal issues, some people don't. It makes a big difference on whether a program will help you succeed or not if you take the wrong program, and that's why it's helpful to have advice to know what is a good program for you. The third thing that any program should have is a maintenance plan. It's not just a diet plan and then you're finished with the diet and you go back to life, but is there a maintenance plan in your proposed program that will help you know that you're not going to have your leader just drop you at the end of the program? You want to make sure that this is sustainable. There's maintenance, and maintenance has been thought out in this program. Every program I will ever discuss with anybody in this community has a maintenance phase associated with it to make sure that you do get permanent weight loss. And finally, any weight loss program can't be just diet or just the food you have, which is most programs, or just the exercise. Because if you do that and if you have a slow metabolism, you're still not going to be burning calories. So any program that's going to bring you to significant permanent weight loss has to teach you how to rev up your metabolism so that you're not in fat storing mode anymore, that you're in fat burning mode. It has to be able to address your metabolism, your fat burning system. And another thing that often holds people in holding weight is their sugar signaling system. And that's what causes a lot of sugar cravings, a lot of triggers for stress eating, And it's really important for a lot of people to have in their program something that teaches them about their sugar signaling, to know and understand so they can get rid of the sugar cravings or stress eating or comfort food eating, and learn to understand their body's signals. Again, most people who hold excess weight haven't been responding to their body's signals for food in years. They're just used to eating because it's a habit. So again, any weight loss program that you consider should respect you, should get you out of that weight loss yo-yo diet system that the weight industry holds people in. It should fulfill the trifecta of weight loss that I talk about. It should support and improve your health. It should help you lose weight in a healthful way. And it should increase your energy. It shouldn't make you feel worn out and starved and hungry. Any program that does that is not supporting your health. It is not likely to be permanent, to be sustainable or maintainable. You want to make sure that you have a program that will make you comfortable, healthy, and will give you this trifecta of improved health, decreased weight, and increased energy as a result of the better metabolism, better fat burning system, and better sugar signaling that you have in your body. And that, my friends, is what can lead you to permanent weight loss. Now, if that sounds complicated, it's because there's not a lot out there that deals with this and guides people to do that. Most programs are what I call the one-size-fits-all programs that tell everybody, lose weight by doing this diet, or lose weight by this exercise, or even a combination of diet and exercise, and they do nothing. They pay no attention to whether your metabolism is slow or fast, whether you have any other obstacles, whether there are hormonal problems or issues, whether there are thyroid issues, whether there are sugar cravings, whether there are any other root causes. You must get rid of root causes that are holding the excess weight. And again, we must rev up your metabolism to burn calories, because if you're not burning calories, you're not going to lose weight. And that's why a lot of people go on these diet programs and they say, I followed everything they said, but I'm not losing weight, or I only lost a little weight. And that is if your body is not burning calories efficiently. And that's the case for most people who hold excess weight. So I encourage you to think about this trifecta of weight loss that you should demand of any program that you go into. It needs to make sense. It needs to be reasonable. And it needs to address all of those root causes. You don't find that a lot out there. I would be happy to discuss with you your needs, your root causes, and how you can get the trifecta of weight loss, losing the pounds, elevating your health, and boosting your energy, feeling so energetic. So if you would like to have some guidance about what would work for you, I will put my schedule in the chat, in the comments. I would be happy to have a discussion. I do have limited appointments available in the upcoming week, but I look forward to bringing you to permanent weight loss so that you can enjoy that trifecta, and most importantly, that you can get it done in a healthful way so that you can feel healthy, you can feel energetic. Your doctor will get off of your back about all those risks, health risks of holding extra weight, like the hypertension, blood pressure, cardiovascular problems, diabetes, autoimmune issues, thyroid issues, so many issues. Again, any weight loss program should support you, help you, and in most cases, so many times when my clients lose weight, their doctors tell them, how did you do this? You lost weight, and now I can lower your medication for the diabetes or thyroid or cholesterol or high blood pressure, or sometimes even people get taken off of medications. And that is because when you know how to improve the metabolism, when you take the steps to speed up the metabolism, it also improves other systems in the body that have not been working well when you hold extra weight. So again, I'm so excited to work with the people who will make these appointments. I can't wait to bring you to permanent, healthy weight loss and better health and elevated energy. Let's get this done for you. Let's talk soon.